Good afternoon, students. Myself, Dr. Umia Pathan, Assistant Professor, DYPCOP College of Physiotherapy. In previous lecture, we have covered massage for upper limb. In that, we have covered effleurage and kneading. In this lecture, we will proceed further. After effleurage and kneading, you will start with picking up. Picking up on the upper limb muscle is usually performed with one hand at once and from proximal to distal. The practitioner's outer hand works on the deltoid, triceps, brachioradialis and inner hand on the bicep brachii and the forearm flexors. The free hand stabilizes the limb adjacent to working hand. Progress should be in small stages of about 1 to 2 cm at a time. The deltoid is picked up using your outer hand with your inner hand stabilizing on the medial side of the arm near the elbow. Find the bony margins of the spine of scapula, the acromion process and anterior border of the clavicle. Now slip down onto the deltoid and totally off the bone. Keep your palm in contact with deltoid all the time so that you compress the whole muscle but pick up rather less of it. Your forearm should be parallel with the patient's forearm and remain so as you work. The pick up is performed by extending your wrist after you have grasped the muscle, and you should neither pivot on your thumb and fingertips nor lever on the heel of your hand. For deltoid, you can use she-shaped grasp for picking up as shown in figure. Vulnerable bony area is the lateral border of bicipital groove and your thumb should be always lie lateral to it and not on it. The tricep is treated by sliding your hand from the tendon of deltoid to the back of arm near the axilla so that you encompass the tricep muscle belly. You can see in the figure. Your fingertips should lie posterior to the medial border of the humerus and the length of your thumb should be posterior to the lateral border of the humerus. Again, keep the whole of your palm in contact with the muscle belly and your forearm low and parallel with that of the patient. Your stabilizing hand should be on biceps near the elbow. Picking up for biceps. As the triceps is completed, your other or stabilizing hand slides out of the way and up to the proximal part of the biceps. Again, your fingertips and length of your thumb lie in front of the adjacent bony borders of humerus with your palm in full contact. In this picture you can see therapist forearm is parallel with that of patient's forearm. As you work down the biceps muscle, your other hand should initially stabilize on the back of the elbow and move out of the way to the outside of the wrist, which is lifted and the palm supinated, so that the working hand can continue to the tendon of insertion of biceps, then slips medially to the forearm flexors. Picking up for forearm flexors. These muscles are picked up using V formation of hand with your fingers on the posteromedial aspect and your thumb on the anterolateral aspect. Again, maintain full palmar contact and narrow V as you proceed down the forearm to the wrist. Picking up for brachioradialis. This requires the use of your outer hand to effect a smooth change by grasping and supporting at the wrist with the previously working hand and sliding your outer hand up the length of the brachioradialis. Keep the forearm lifted to relax the muscle and pick up using a V formation until reach the musculotendinous junction, which is 2/3 of the way down the forearm. Many people continue to perform a picking up action as a squeeze on both aspects of distal end of forearm to preserve continuity of contact. At this point in a sequence on the arm, the forearm extensors are often thumb needle. Alternatively, you can return to the shoulder area to perform wringing. After picking up, start with wringing. Wringing is most easily performed on the long muscles of the triceps and biceps brachii. It is possible to wring a flabby or very relaxed deltoid, but the muscle is so short that it presents difficulties in performance. Wringing for deltoid and triceps. The deltoid and triceps can be wrung by pivoting your stance and your body so that you are nearer to the patient and your nearest foot is in between the model and the table. In both cases, your fingers should be on the back of the arm and your thumbs towards the front and medial side. Ensure that these components of your hands are not lying over the adjacent bony border, the bicipital groove in case of deltoid and lateral border of the humerus in case of triceps. You can see in this picture. The muscles should be grasped at their most proximal end and you should work to the distal end and perhaps return. Try to proceed in small stages so that your hands move about 2 to 4 cm at a time and more constantly. For the bicep, you will need to move your stance slightly to the outer side of the arm support and again use your fingers on the medial side anterior to the medial border of humerus and your thumbs on the lateral side anterior to the lateral border of humerus. Again, work from most proximal to the distal part of the muscle and perhaps return and work in small stages similar to the triceps. Be very careful in bringing these muscles not to drag on the skin and keep your hand changes of direction very smooth. Dry hands are a great help in ensuring smooth, non-dragging work. Bringing over brachioradialis. The belly of the brachioradialis may be wrung using your thumb pads and the pads of your index, middle and sometimes ring fingers. The patient's forearm should be fully supported in mid-pronation and supination. Bringing over hand. Teeny bringing manipulations done with the tips of your index fingers and slides of your thumb tips can be performed on the intrinsic muscles of the thenar and hypothenar eminence. The two abductor and two flexor muscles are more easily treated in this way. After bringing, you can start with muscle shaking. Muscle shaking to the deltoid. The shorter deltoid muscle can be shaken using your outer hand. Take care not to bounce on the bicipital groove with your thumb. Muscle shaking for triceps. The triceps muscle is shaken again using your outer hand and proceeding from near the axilla to the elbow. You can see in this picture, therapist is shaking from axilla to the elbow. Muscle shaking for brachioradialis. In the forearm, a bulky brachioradialis may be shaken using the thumb pad and the lateral side of the flexed phalanges of index finger of your inner or outer hand. Muscle shaking for the hand. In the hand, you may be able to shake the bulk of both the hypothenar and thenar eminence and in some subjects to select and shake the abductor brevis pollicis and abductor digiti minimi using the tips of your thumb and index finger. After shaking, you can start with muscle rolling. Muscle rolling can be performed on each of the upper limb muscles which can be picked up, and this manipulation is often easier to perform on the brachioradialis than either bringing or picking up. Place your thumbs and fingers as though you intended to do ringing as described above and push the muscle belly gently first with both of your thumbs while your fingers relaxed but stay in contact. Then pull with the distal phalanges of all your fingers while your thumbs relaxed but stay in contact. Proceed along the length of each muscle, working down then up with this rocking action. Work fairly quickly and with a slight pressure inward towards the midline of the limb so that the muscle rolls from side to side. Muscle rolling can also be performed with the thumb and and fingertips on the two flexors and two abductor muscles of the thenar and hypothenar eminence. This manipulation can also be used to rock or roll scarce and adherent tissue. After muscle rolling, start with hacking and then clapping. Hacking and clapping are usually performed successively to first one aspect of upper limb, then to other, so that the limb is moved only once. With the patient's forearm pronated, start the posterior axilla and work down the posterior part of the deltoid, triceps, each round to the back of the arm to do so, and then on the forearm extensors. You may need to stop the hacking at mid forearm in bony subjects, but you should able to clap on the dorsum of the hand. Stand nearer the patient for this work. Turn the forearm to supination and lift the elbow medially so that the limb rests comfortably on the support. Either stand on the outer side of the support or step nearer to the patient's feet. Starting at the axilla, work down the front of the deltoid, biceps and forearm muscle and the palm of the hand and reverse up the limb. By working in this way, you will start the muscle fibers across their longitudinal axis. In both lines of work, you should work in a zigzag fashion on each muscle if it is bulky or wide enough. Avoid bony prominences and large tendons and jump over them. Clapping is performed in a similar pattern using a more cupped hand on more slender part of the limb. You can see in this picture the therapist is doing clapping from proximal to distal, okay, and you can perform clapping in same manner as you perform in hacking. So this all includes the massage for upper limb. Okay, so for massage to upper limb, you start with effleurage from distal to proximal. Then after effleurage, start with kneading. Okay, after kneading, you just pick up the muscles and release it. After picking up, start with wringing. Okay, after wringing, come to muscle shaking. Okay, after muscle shaking, start with muscle rolling, and lastly start with hacking and clapping. But while giving all these massage techniques, before starting of every treatment, first you start with effleurage, meaning if you want to give wringing, if you want to give ringing before picking up, after finished with picking up, again you do effleurage and then do bringing. Okay, as soon as you finished with bringing, again you do effleurage and then do muscle shaking. Like that you have to do.
Only facing up. The question is, the answer is no. I can do it also facing up, facing down, but facing up is a lot easier. So yes, when they are facing down, you can massage the arm, and if we have time, I'll show you. But when they're facing up, you take the arm. There is actually, you can massage here. You can then lift it. You can do the forearm completely. Then you can massage the front and the side. If you want to massage the back, you can put it here. You can massage them on the body. Or you can come from above and hold it and then massage from there. So it's a lot more opportunities to give massage in different ways. Yeah? So just to be sure we're all on the same language. Anatomically, we're not going to do the palm now. We're going to do it some other time. But we might do a little bit. So this area called the forearm, and which bones are there? Radius, remember, that's the radius, and that's the ulnar, and humerus, good. And the humerus attached to which joint, to which bone? Scapula. And scapula is on the back here. And then what's the name of this bone? Okay. So one problem that arises with massaging the arm, that as opposed to other part of the body, is kind of floppy. So when it comes to massaging it, you see, for example, to put it even, sometimes you will have kind of difficulties. So imagine when you're massaging, yeah? Imagine when I'm massaging, look what happened to his shoulder, you see? Imagine that I'm knitted. It's kind of uncomfortable, isn't it? So to start with, the problem is that you have to fix that part of the hand. So at times I can work only with one hand. Yeah. Or even swap these. Yeah. But be sure that that kind of things doesn't happen, because it's very uncomfortable and they will be uncomfortable. Okay. So, let's start. Let's start with the forearms. In the forearms, two more things before we start. Actually, the arm can be quite long. So at times, your position, you have to be smart with your position. If I start here, when I get into there, look what happened to me. Almost, or hurt my back. And I think that a lot of you, your starting position is good, but you run out of space very quickly. So many times you have to start here and then move yourself. And it might be that some of you need to do the step to do that. Yeah? No, you can, but you don't have to. Okay. And one more thing is that where does the arm finish? Is it finished here or here? I actually think about it that the arm ends up in the occipital. Yeah? So think about that in terms of a line, Jody. You know, we talked about lines, how wonderful this line is. Look about that you actually finish the arm here. Yeah? And then you take it round to the side. So think about it as kind of end here. Yeah? And it kind of makes sense, because this is where you kind of end up with. Even, you know, you can do that. It's great because you give the brain a sensation of continuation. It's not segmented. Yeah? And after that we learn that some of the muscle that hold the shoulder in place really start from there. So it makes sense also functionally to do it. Yeah? That kind of flow. Okay. Doesn't mean that every stroke you do, but once in a while it would be nice to do that kind of stroke and stretch it all the way up. Okay? So once you do effleurage, you do it only to the front. After that I'll show you to the back. You can now start working in segment. So I will bring a chair. I always like to work with a bit of a old chair. Yeah, thank you, Heather. Yeah. So it's called the proposal position. It's called the proposal position. So we start getting into technique that we're using mobilization of joints. Yes. So with that, mobilization is when you move in the joint. With that, sometimes comes a bit of tension from some clients to how well they allow you to move themselves, how relaxed they are. So just be aware that sometimes you need to kind of play tricks with them, even to do just that, to relax them and let them feel what relaxation means really. It's not easy for some people. So you start by working on the forearm. In the forearm we have two groups of muscles. Yeah? I want you to take your hands here. The first group is the anterior group. The second one is the posterior group. So you need to work on both of them. If the arm is in neutral, it's kind of very easy. This is the posterior group, and this is the anterior group. So you can work it in a few ways. You can do it that way, just by clumping two fingers and just stretching it. Or you can do it in different position, like that. Good. Or a bit more kind of petrissage, yeah? A bit more movement and trying to isolate this and separate these muscles here and on the flexor. So it's a little bit funny because you start to think, where is this? Where are these muscles? So one is really to the outside, more is to the inside, but I'll let you kind of try things out and see where they are. Yeah? What do you think would be good to work with on the forearms? Builders?
Handicap.
Yeah. Yeah. So they need to lift themselves. Maybe crutches. People with crutches. Remember that kind of fracture with the scenario we did last time? Who else? Why?
This is from personal experience. I don't know why, but my grandma likes it on the arms.
Okay. Yeah. Maybe it's kind of very kind of nice and soothing, and you don't have to undress for that. Yeah. Who else? Big chunk of
Physiotherapist.
yeah, massage therapist also. And
Massage therapist also. People who work on PC.
yeah, exactly.
Yeah, sure.
So a lot of typing. So a lot of people would have tenderness here. Yeah? So again, you can do the effleurage.
Can I ask, is the effleurage similar to the legs in the fact that you're not trying to put pressure coming down, you're only putting pressure towards the
Yes. Yeah. And then you can do the petrissage this way or bend it. And when you bend it, you're just putting your elbow here like a support. Good. Once I find a place, here I am ready for compression. Now with a bit more friction. How is it coming? How is the pressure? Can I go deeper? It is a tender place. A lot of tension there. From most of us, yeah. Once in a while again, take it to the suboccipital area.
Once in a while again, take it to the suboccipital area.
Then you can start working on the shoulder itself. You can put the arm in here. You can come and massage the shoulder itself. Really nice. Do you know the name of the muscle that I'm working on now? Actually, trapezius will be tiny bit deltoid. So deltoid and trapezius, yeah. But you can actually work on both. I actually worked on both. So yeah, you were both right.
Yeah, you were both right.
Yeah, yeah. With these fingers and with the other hand, the deltoid. Good. Now, if I want to work on the back of the arm, I can do one of these. I can bring it here.
I can do one of these. I can bring it here.
Yeah. Even come from the opposite side.
Yeah. Even come from
And it's nice to just kind of
And it's nice to just
do it this way.
kind of.
Yeah. If the breast is on the side, on its way, you can move it a little bit downward and then do it this way. So I need again to hold it and to keep it quick. Even do a nice movement all the way.
Nice movement all the way.
Yeah. Nice shoulder. I'm on the back of the arm. Very easy. Yeah.
Very easy. Yeah.
Good. Yeah. And even further, you can bring it upward. So come downward, please, and then go all the way down so you could see what I'm doing. And then you're holding it onto your body. The holding is quite important because I want you to move with, and later in the course we'll learn a lot more about this technique, and then you move your body. You don't move the arms, you move your body with. Yeah? And then you have a wonderful opportunity to massage the triceps muscle, which is on the back. It's okay if you don't know this muscle, you will from next week, from this week, yeah, from tomorrow. We'll learn a lot about this. Yeah, and while you're doing that, move a little bit. Again, it's nice combination to just move and do pec massage, or work on compression. If needed, that's kind of unusual place, but some athletes would be really good to work on. Yeah? And then even nicely to just finish it with a really nice stretch upward. Even just a nice complete relaxation this way, and it will open, we'll see kind of a lot. It opens the chest and all that area that we're all very relaxed. I pull it, yes, I stretch it a little bit that way. Yeah? So again, coming from here, starting all the way, and then doing the forearms, and then doing the arm itself, swapping. You can do it now from this side, working on the triceps muscle from here, or from here. I know it looks easy, but when you start it... I know it looks Okay, shall we start?
Okay, shall we start?